Hey guys, welcome to another episode of the 4 Pillars of Health with Kevin Davis. Today we're going to talk about the 5 top labs that you can get to predict longevity in your life. Now, I want you to stay tuned because we're going to talk about what longevity means. We're going to talk about like metabolic health. I'm going to give you 4 simple things that you can do to help correct these things in your daily lifestyle. And at the end, I'm going to talk a little bit about a new program that I have that's going to incorporate these labs along with about 30 other blood markers to help you get optimal health in different areas of your life. If you don't know me, my name is Kevin Davis, and I am a physician assistant and online health coach. And what I do is try to help guys lose weight, get healthy, get metabolically healthy so that they can enjoy the fruits of their labor, the hard work that they put in over the years' time. So today, let's talk about metabolic health and let's talk about longevity. Now, with metabolic health, you may be thinking, what in the world what do you mean by metabolically health? Basically, metabolic health is about how your body takes your food and the nutrients and the supplements that you give it, and it turns it into energy. So if you're somebody who is lacking energy, if you're somebody who has not got optimal health, a lot of times you can trace it back to metabolic dysfunction. So if you think about a tree and you think about the root system versus like the fruits on the limbs, if you have good fruits, then you have a good root system. If you have a bad root system, then your fruit is not going to be good. So your metabolic health is the root system. The things like diabetes, high blood pressure, Alzheimer's, those type of things, that's the fruit. So if you're seeing those things in your life, then you know you have something that's going on internally that is causing you to have these symptoms. What I always tell people is this: your body is doing exactly what you tell it to do. If you're giving your body signals to store fat by eating processed foods, excess sugar, things like that, then your body is programmed to store fat. So your body's doing what it's told to do. If you are somebody who's healthy and trim and has good metabolic factors and numbers, then your body is doing what it's told because you're telling it the good inputs. Good inputs equals good outcome. Bad inputs equals bad outcome. And that's something simple that you can do that you can kind of correct the things in your life. Now, you may be thinking about, okay, why do I have to worry about metabolic health? Well, you can look at 5 of the top 10 things that we're talking about as far as long-term problems, such as cancer, diabetes, increased liver functions, kidney disease, heart disease. Those things have their beginnings in metabolic dysfunction. So again, it's the fruits on the tree. You see those things, those are bad. So instead of if you have high blood pressure, if you have diabetes, instead of just automatically thinking, what pill do I need to take? You maybe need to change your thinking to say, okay, what kind of lifestyle changes do I need to make so that I can get rid of those problems? And that's what we're going to talk about today. Now, how do you know if you have metabolic dysfunction? Now, there's all kinds of labs you can do. In our panel that we do, we have probably over 40 different labs that we do. We're going to talk about just 5 of them today. But we take these numbers and we give you scores with it, and you're able to see what your score is for your age and your sex. Now, if you're not doing that and you just do simple labs and you have these from your doctor's office, you can kind of get an idea of your underlying metabolic health by these things. What is your waist circumference? If you're a man and you have it over 40, and if you're a female over 35, if you have a low HDL, that's your good cholesterol. If you have a high triglycerides, which we're going to talk about later, if you have diabetes or are treated for diabetes or abnormal blood sugars, or if you have high blood pressure or taking medications for blood pressure. If you have 3 out of 5 of these, traditionally what we tell you is you have metabolic syndrome, meaning you have metabolic dysfunction. So, if you don't want to do the labs, that's fine. That's for people who want to take a deeper dive so they know exactly what to do. But if you have 3 out of 5 of these, you have some problems. And this podcast is going to help you uncover some of those things that you can do as far as supplements and things like that, but also lifestyle factors, which we'll talk at the end. So the first thing that we're going to talk about as far as the top 5 lab, as far as the things that you show metabolic dysfunction and decreased longevity, is vitamin D. Now, vitamin D is a fat-soluble vitamin. It is associated with healthy aging. It helps your body absorb calcium, so it helps with your bones and things like that. So anything that's good for your bones is usually good for your muscles as well too, especially when you're talking about exercise. Now, it supports the immune system. It fights off infection, illnesses, and things like that. Now, in my labs or my clinic, I would say probably 95% of people that we check is deficient in vitamin D. I'm not sure why that is. I have some feelings about that. And one of the things I think, and I'm not seeing any evidence for this, is just the processed foods that we have here has to do with maybe the absorption and things like that we have. So I think that has some problems with it. If you're a guy, testosterone, having low vitamin D, is associated with lower testosterone. As a guys, when we start to be age 30 or 40, we start losing 1% to 2% of our testosterone anyway. So vitamin D is also added that if you have low vitamin D, you can add, that's another risk factor for your low testosterone. And muscle mass, lower muscle mass is associated with decreased protein synthesis, which is the building of the muscles from the amino acids, and also with sleep. If you have problems sleeping, it could be due to a low vitamin D. So those are some of the things with vitamin D, and all those things that we're going to talk about today has to do with longevity. And again, God only knows how long we're going to live, but we can look at these markers and see, okay, these things, a lot of them are associated with increased longevity. And it's not just about living longer, it's about living longer healthier, be able to do the things you want to do. And that's what we want to encourage you to do. Now, the second lab we're going to talk about is called your HSCRP. It's a highly sensitive C-reactive protein. It measures inflammation. So anything that causes chronic inflammation is associated with decreased longevity. Now, we need inflammation. Just like about anything in our body, there's neither really a good or a bad, or there's good and there's bad, but what we want to do is an optimal level. So we need some inflammation. If you sprain an ankle, if you have an injury, your body's response to that is having inflammation. It sends things through your blood to heal whatever is going on. So we need to have that, but the problem that we have is that is turned on all the time. So if we have it chronically turned on, that chronic elevation is what causes a lot of is associated with a lot of chronic diseases. So if we can kind of help that, it helps with our immunity, help with our heart health, it helps with longevity as well. The third thing lab we want to talk about is your blood glucose and your hemoglobin A1C. Now, normal blood sugar fasting should be under 100. Now, sometimes people can have a normal fasting blood sugar or mildly elevated, but they can be diabetic. It is when they eat is when their blood sugar goes up. Now, anytime I get a blood sugar over 100 at my clinic, I really try to get a 3-hour glucose tolerance test. If you're a female and you're listening to this, you've done this when you were pregnant, is you drink the oral glucose and they check your sugar every hour for 3 hours by a finger stick, and it's supposed to go up some but then back down within a certain range. If it doesn't do that, or if it goes above 200, then you're talking about diabetes. So if it's something that you need to really check on, and one of the things kind of like plug that I try to do for myself, and I know Danae does this as well, is we wear a continuous glucose monitor just to see how foods are affecting us. But when you have increased blood sugar, you're going to have increased insulin. So when you have increased insulin, the hyperinsulinemia is a root cause for a lot of metabolic dysfunction. If a woman has PCOS, polycystic ovarian disease, that can be a root cause of having too much insulin for polycystic ovarian disease. Having hyperinsulinemia, insulin is a growth factor, so you kind of grow in what insulin does is it takes that sugar, especially if you're eating excess sugar, and it takes it from your blood and puts it into cells, your muscle cells, fat cells, liver cells, things like that, and you store that excess fat. And when you have increased sugar, it can lead to long-term problems, which decreases your longevity. Sleep, if you're not sleeping well, it can increase your cortisol. Cortisol will increase your glucose, which increases your insulin. So those type of things is a whole effect as far as the things that you can do to feel better just by making some lifestyle changes. Now, fourth thing is increased LDL cholesterol. Now, I know there's a lot of controversy as far as LDL. That's what your bad cholesterol. So, but some of the things that's been associated with longevity is having a chronically elevated LDL over a period of time. Now, I know I've read some papers that contradict this, and I know some people on there that I listen to that say LDL it doesn't really have an effect on your heart and things like that. But there are some associations with decreased longevity with increased LDL. So you need to have optimal levels. And the optimal levels will help with your digestion, it help with the fat digestion in your body, and it's a precursor to several hormones too. So we need to make sure that we have the optimal amount. And the fifth thing that we look at is your triglycerides. Now, triglycerides are a type of fat that's found in your blood, and it's a storage of this fat. So when you have excess sugar, it gets stored as triglycerides. A lot of times it gets stored in your liver. And if you've been a patient of mine or have heard me talk before, people who have fatty liver, a lot of times the root cause of that is having too much sugar. Now, there's some other reasons, and we do some other blood work to rule those things out. But a lot of times it kind of circles back to your lifestyle as far as the things that you're doing to have too much sugar. And some of the things we're going to talk about, the things you can do to help with that in just a minute. It'll help decrease your triglycerides. So when you have high triglycerides, it's an indication that I think of when I first look at it. It seems like it's always a combination. You have high triglycerides, you have low HDL, and that combination usually is a precursor for metabolic syndrome, for pre-diabetes, for diabetes. So if we can catch these things early, before you even develop diabetes, you're going to be so much better off than letting these things form, then trying to deal with the problems because they've been there for a long period of time. Now, when we talk about blood testing, again, I've talked about this before. There's a reference range. Reference range is what it is for the general public. And then there's an optimal range. Let's take insulin, for instance. The reference range in most labs are anywhere from 2 to 5 up to 20 or to 24. Different labs have different reference ranges. Now, that's where the majority of the people, when people do labs, these labs get all these numbers together, and this is like what the average is as far as like everybody's concerned. That's not optimal though. Optimal levels would be less than 5, definitely less than 10. So if you have an insulin level of 20, you're still in the normal reference range. But personally, I do not think that's in the optimal range. So you have to kind of know what that is as far as the optimal range, what numbers it is. Because if you can catch things, if I do an insulin level on somebody and their level's 20, if I can start making some just slight changes in their lifestyle, a lot of times that insulin level will go down and won't continue to rise and have problems. So 10 years from now, then we're dealing with diabetes along with hyperinsulinemia. Now, one of the things that I have come across and I've due to with my clients now, I have an app now that we insert labs and they give them scores as far as different stages, and as far as like your cognitive health, your heart health, your physical health, your sleep. There's 5 or 6 different things that we kind of plug these numbers in, and each of these labs that we do kind of like is a indicator of having problems in certain areas. So if that's something that you might be interested in, let me know. I can we can do a Zoom. I can share my screen, show you kind of like what we're doing with that. So if you want optimal health, I think that's a great place to start to get that path where you're going to be healthy. So what's 4 things that you can do today that can improve your longevity and improve your metabolic health? First thing is decrease fructose. Fructose, high fructose corn syrup, those type of things that's in pop, cookies, cakes, and those type of foods. If you can just eliminate those things from your diet. And I'm not saying you have to eliminate them, even though it'd be best, even if you're eating a ton of them, if you cut it in half and then later on cut it in half. If you start that path going down, when you have excess fructose, it gets stored as fat in your liver, and it's going to lead to things like fibrosis, cirrhosis, and things like that. And that's going to cause a lot of detrimental problems from your health. So just getting rid of those type of things, eating more whole foods. Second thing is if you're having some of these problems with the high triglycerides, the insulinemia, high blood sugars, the things we talked about earlier. If you're having those problems, you need to decrease your carbs. Now, if you have carbs in your diet, especially for energy, a lot of people working out will need to have those or want to have those. Then eating complex carbs, not eating the simple things, like the French fries, those type of things, potato chips. Eating more vegetables, eating more brown rice, even though brown rice does have a lot of problems with storage of fat in your liver, but that's something that you can include, especially if you're working out. So a lot of this is individualized for the person, depending on what they're doing. If I have somebody who's working out hard for an hour versus somebody who's not working out, my recommendations are going to be different because their bodies are different. They're doing different things. So, as far as the carb intake, if you can limit it to, the vegetables and the seasonal fruits, I think that's going to be the best bet for you. Third thing you can do is increase your exercise. Anytime that you increase your exercise, it's going to increase your longevity. It's going to help with these things that we've already talked about, again, like your insulin and your blood sugars and things like that. And it's going to increase your muscle mass. So that's going to help as far as longevity. So just make sure that you incorporate that into your lifestyle as well, too. And the fourth thing you can start doing is fasting. Fasting does not mean you eat less. It just means you eat less often. You eat the same amount of foods because especially with protein, we want to make sure that you're getting the right amount of protein in your body, but we want to be eating less often. Now, I used to do a lot of fasting. I used to fast 24 hours a day sometimes. A lot of times I would fast 18 to 20 hours. Now, since I've lost my weight and I've become more metabolically healthy, my triglycerides have improved, my insulin levels improved, my sugars improved, LDLs improved, all those things have improved. I don't fast as much. And again, what a lot of people do to get to where they want to go doesn't necessarily mean they have to keep doing those same things. Now, you may have to do them for a while, but probably not the rest of your life. Again, I've been doing this over 15 years. So, I've been down this road a little bit longer than most people. So a lot of times when we talk about, changing lifestyle, people think, well, I can't do this the rest of my life. Well, sometimes you don't have to. Sometimes you have to do it for a season, sometimes 2 seasons. But then a lot of times after that, those things will improve, and you won't have to continue doing that. You can, I don't want to say cheat meals, but you can add some stuff to your diet. So I eat more carbs now than I used to do. And, I still keep my weight off, still exercise, still do those type of things. So that's where the individualized approach comes. And it's not necessarily what you do now is what you're going to do later. So hopefully that's helped. Again, we have an awesome new app that I would love to sit down and show it to you on a Zoom call. It takes, maybe 15 minutes. Just to kind of show you what it does. I can show you my labs, where I'm at, and show you all the blood markers that we do. And it really breaks it down. And I'll probably do a podcast in the future about this, and maybe even do a video podcast on my computer to kind of show people what I'm doing as far as like being able to help people identify their things that are causing maybe their problems, and we can correct those things specifically for them. We also have a course that you can join. It's a 12-week course. It includes, information as far as what to do, and it also helps that we are able to have conversations through a group Zoom call once a week to help you kind of get over hurdles, to keep you accountable, so that after 12 weeks you really know what to do as far as your lifestyle and the changes that you need to make to get the results you want to get. So hopefully that's helped, and I really thought this was important that that even if you're not a patient of mine, even if you're across the world somewhere listening to this, I know people in other countries listen to this. If you can get these labs done, it will give you a good start as far as the path that you need to go. Start making these simple corrections in your lifestyle. So let's turn our attention now to the catechisms, and today we're going to talk about why is it called the Lord's Day? Because on that day, Christ rose from the dead. So when we just celebrated Easter, I'm not sure when you're listening to this, but we just celebrated Easter. And it's kind of like, God has these timings as far as when I have these on here, what's happening in my life and overall everywhere. So, Christ rose from the dead. On Good Friday, it was a day when he was put to death on the cross. But on Easter Sunday, he rose again. And that's what we hang our hat on as far as Christians, is because if that is not true, then the whole Bible is worthless, because that has to be true. And that has to be our way to get to heaven, is through Jesus Christ and accepting him as our personal Lord and Savior. So again, we always reach out. We want to have questions, conversations with people who have questions. If you have any questions about that, we would love to sit down and have a conversation with you. We'll set a Zoom time up and just go through it, go through Scripture, just kind of see what exactly does that mean and what is it exactly that you need to do. Because some people, when you hear get saved, they say, I don't really know what that means. Well, let's have a conversation about that. I would love to have it with you. Please reach out. But anyway, again, these are the 5 top labs that you need to look at for longevity and metabolic dysfunction. And hopefully that's helped. I'll try to include some of the stuff in the show notes for you. And you guys have a blessed day.
This podcast is for informational purposes only. No patient-provider relationship is implied or established. This podcast in no way represents the practice of medicine. The information given is to be used at the listener's own risk. Please consult your provider before making any changes, as the contents of this podcast is no substitution for your provider's instruction.